Why your estrogen levels may be low. Here's a complete Harvard Medical School certified list of reasons that estrogen levels drop. 1. Perimenopause and menopause. 2. Hypogonadism. So your gonads, which are the ovaries in women and testicles in men, aren't making the hormones like they used to. Medically put, this means the gonads have decreased functional activity, and this may be genetic, such as with Turner syndrome, where a woman is missing one X chromosome. Number 3, hypopituitarism, which means decreased production of one of the 8 hormones that modulate your endocrine glands, such as follicle stimulating hormone. Number 4, hypothalamic defects, which is decreased production of estrogen due to a problem with the hypothalamus, which is the part of your ovaries that really controls how they produce estrogen. An example of this would be Kallman's syndrome, which is a genetic disorder associated with loss of smell and lack of gonadotropin releasing hormone, which results in low estrogen. Next, number 5 is pregnancy failure. When a baby is not carried to term, which occurs in 15 to 20% of pregnancies, the mother's hormone levels drop and her estrogen levels may plummet temporarily as well. Number 6, delivery of placenta after childbirth. This temporarily causes you to enter kind of a menopausal state because of your low estrogen and progesterone levels, and usually lasts until your next period or your period returns. Number 7 is breastfeeding. Depending on frequency, volume, and duration, breastfeeding lowers your estrogen levels and may prevent ovulation. Next is anorexia nervosa, bulimia, and other eating disorders, including undereating. Lower body fat can cause lower estradiol levels, which can lead to amenorrhea or the loss of your period for 3 months or longer. This also would include our next one, which is overtraining or extreme exercise, which is very common, and this can of course contribute to lower body fat levels and further exacerbate the problem if you are under eating. And then lastly is a gluten intolerance. This is an increasingly common reason for estrogen-related problems such as amenorrhea, infertility, and diminished ovarian reserve, but also it can influence higher estrogen levels.